Hello, I'm Dr. Gary Thorn. I work at FirstCare South here in Fayetteville, Arkansas. We're going to talk about a very important topic of high blood pressure. The first question is, how do I know if I have high blood pressure? And that is known as a direct result of a measurement using a blood pressure cuff. That can be done not only at a physician's office, but accurate measurement can be made at a machine at most pharmacies that they have. Perhaps a family member's blood pressure cuff would work as well. Normal blood pressure is defined as being optimally somewhere between 120/70 and 130/80. Now, the definition of hypertension, the medical term for high blood pressure, is blood pressure that's over 140/90. For most people, any trip to a doctor's office is going to include a measurement of blood pressure so that in case that it is elevated, unbeknownst to the patient, we'll be able to see that. However, if you're just checking out around town at a pharmacy's machine, perhaps once a year is plenty. If you've been determined to have high blood pressure, there are several things that you can start to do. And actually, this should begin if your blood pressure is even somewhere in the range of between 130/80 and 140/90. Losing excess weight can help lower blood pressure. Cutting back on the amount of salt in your diet, that's a big factor in elevated blood pressure. And the general recommendation is to limit one's salt or sodium intake to about 2,000 milligrams per day, which is not much, but that will also go a long way in controlling blood pressure. In addition to these things, exercise, or good aerobic exercise, can also help gradually reduce blood pressure. And a great example of this is just walking, which is wonderful aerobic exercise. The current recommendation would be just as little as 10 minutes, about 3 to 5 times a week. More than likely, it would be better to walk about 30 minutes if the time can be carved out for that. But that goes a long way as well at reducing blood pressure. Now, if those type of changes in your lifestyle do not completely reduce the blood pressure to that normal or optimal range, then that's when medicines have to be used to help lower blood pressure. So that would require seeing your physician and then being prescribed the appropriate blood pressure medicine to help normalize blood pressure and therefore reduce the risk of having a heart attack or a stroke sometime down the road. Once again, I'm Dr. Gary Thorn. I practice at FirstCare Family Doctors, FirstCare South here in Fayetteville, Arkansas. And if you have any concerns that your blood pressure may be too high, then give us a call or go to mana.md and check out the website there for further information. Thank you.